What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. In today's video, we're covering things that surprised me about my X-ray tech job. So to give you context, I do night shift, 7 on, 7 off, work a lot of overtime, so I dabble in day shift. So the several things that surprised me about X-ray, we can start when I was like a student all the way to now. When I was a student, I just assumed that all X-ray techs did was just take the actual pictures and like the actual film and stuff, which that's exactly what I was, expecting going in. And then slowly I learned how much how radiology as a whole, how much like X-ray was kind of at the bottom, but then it branches out and it can do so much, which most people who see you think you're just a nurse because you're in scrubs. So that one off the bat just blew my mind. The next thing that kind of opened my eyes out was the level of, I expected someone in the medical field to have high level of like nurses, because I've seen always nurses and doctors a high level of stress. They're always documenting, they're always on the phone calling people, and then once I got into clinicals and I saw how chill and laid back most of the techs were, unless there was trauma, they'd just be chilling on their computer waiting, and they were kind of like the cool kids of the hospital. And I was like, I'm in the right joint, And it wasn't until my first day of clinicals where one of the techs took me under his wing, and I was like, okay, I want the full workload experience, from start to finish, what I gotta do, And then he said, okay, watch. And he just literally took me step by step, and then we finished. And I was like, that's it. And he said, yeah. And then we do this all over again. And I was like, bro, this is easy. I can do this all day, baby. That right there. And then fast forward to where I am now as a tech who's done it. You see how it's the same thing over and over, but you'll sprinkle in a little variation, which helps spice up the job. I mean, granted, when stuff happens, it's different. It does suck because that means someone usually got hurt, car crash, or they broke something, which adds just a variable to the job. I would say that the most common thing that surprises everyone is the involvement of how much patient care we do is very, very little, minuscule compared to all the other healthcare people in the hospital. And this is speaking based off of me and my lady's a nurse. I could literally go in there, and if it's a chest x-ray, 30 seconds be out, in and out in 30 seconds. A minute if I accidentally clip something and gotta shoot it again. And then compared to the nurse, they can be there all the way from a minute if it's just a quick talk, all the way to I've seen them go 25-30 minutes depending if it's a hard stick and all the stuff going on. It's crazy. Same thing if they start coding and the patient starts going downhill. Literally them and the doctor just go hand, and respiratory will be there constantly monitoring, and we're just in the back corner just all right, well, let us know when they're stable so we can do our 30 seconds worth of work and keep it pushing, which ain't a bad gig. It's not. It surprises me. So if you're more hands-on, I mean, X-ray is it is all our job is full hands-on because they're manipulating the patient to get the best images, but it's in short segments. We're not as intense care. Someone can ask us, oh, why are you doing this? And we'll be okay, you're short of breath. But we really don't even look deeper into their whole history versus the nurses and the doctor. They'll go very deep into their medical history, what's going on, and get a full rundown. when I go do morning reports, there's like 50 patients that all can't breathe. I'm not looking into. Maybe I'll like look if someone's been there for a long time. I might like, or if there's specific notes of what's going on, or critiques about my pictures. Then I might like go back and look into their history and stuff. But like most of us really don't. That's something that surprised me. And yeah, it's pretty more Miguel. See you on the next one.